I'm going to try and go through Unit 4 in a fairly quick manner. I don't want to spend forever doing this. Each of the videos will be about 15 minutes long, and hopefully I can do it in like 6. If you're now sitting looking at about 20 videos, sorry. I'm going to go through this fast, so also sorry Amy, I know you like to write things down, but you can pause this and write it down, the wonders of technology. Right, so first thing remember you need to know is about definitions of abnormality. So it's 2 different definitions we need to know. I'm going to go through them just using the bullet points on these slides really, and I'll try to expand as we go. So remember, a social norm is a thing that each culture believes in. So in Britain we have social norms that govern what is normal and abnormal behaviour. Anyone who breaks the social norms is seen as being abnormal. So we've got behaviours about how you should dress, what you should wear, and so on. And literally, abnormality is anyone who breaks one of these social norms. In psychology, there's various things that kind of influence or affect these social norms. This is a good time to mention that I don't have my textbook because Jennifer has stolen it. So as I go through, if I forget things, I'm sorry, you're just going to have to deal with that. So there's various things that affect these social norms. So age. Yeah. The example I always use is tantrums. Believe it or not, there is actually mental illness about tantrums to do with age specifically. So an adult throwing a temper tantrum would be very different or viewed very differently from a child under the age of say 3. And believe it or not, about the age of 5, if you're throwing more than 3 temper tantrums a week and they last more than 15 minutes, that's also counted as kind of a mental illness. So again, it shows the influence of age. We've got context. So again, it's a perfectly normal behaviour to wear a bikini on the beach or to wear your going out clothes to the club, whereas if you wore them to college, we might think that was unusual. That's unusual sort of behaviour. And we've got gender-specific behaviours or gender stereotypes that fit into this idea of norms, and if you break them, you're seen as abnormal again. And we've got historical ones. So again, the example classically is homosexuality. Being gay was a mental illness up until 1967, whereas it isn't anymore. This also highlights some of the strengths and weaknesses of the actual approach. So we've got some evaluations. So a social norm definition of abnormality could be used to control those who aren't seen as being normal. Again, this is Thomas Zazz's work. Behaviour deemed as normal in one society might be abnormal in another. It allows the global nature of behaviour to be assessed rather than relying on specific symptoms. So again, that allows us to see, rather than looking at a checklist of symptoms, which might not be very valid, it lets us see if your behaviour is different and making people uncomfortable. We can talk about how social norms change. So social norms are not the same as now as they were before. So is it really fair to say some people were abnormal previously and they're not now, or it could be vice versa? This allows for cultural norms. So this explains various things like the culture-bound syndromes, why some behaviours are seen as normal in one place and abnormal in another. I'm going to just double check the other PowerPoint to see if there's anything else I'm missing. That's the wrong PowerPoint. Sorry, there's the other one, and I missed context. I've already covered that, sorry. So, if every culture is different, a big one is if every culture is different, can we really define what is normal and abnormal at all? Yeah, if we're saying something is abnormal, is that really fair when they may be living up to the cultural norms of another culture? Right, so the second definition, again, I'm just going through this as quick as I can. It just gives you something to perhaps listen to, where if your notes aren't making sense, maybe my wonderful descriptions will. So statistical deviation from norms is slightly different, remember. So we have a thing called a normal distribution or a normal distribution curve. This is where the mean, mode and median all fall within the center of this particular graph. So this white line in the middle is both the mean, mode and median. In IQ, remember that's 100. And we can do a set particular mathematical process from that to figure out what we call a standard deviation. So this dark blue area is a standard deviation, 1 in each direction. So 1 standard deviation below, 1 standard deviation above. And roughly 34.1%, I say roughly, exactly, 34.1% of the population will be either side of this. So again, in IQ, the the mean, mode, and median are 100, and this first standard deviation is about 15 IQ points either direction. Yeah, a second standard deviation adds in an extra 13.6% of people on either direction. So remember, each one of these standard deviations are talking about people. So this is 34.1% of the population, one standard deviation away either direction, and then a further 13.6 is one standard deviation away. Sorry, two standard deviations away further. So we can look and see how much of the population this kind of covers. So remember, abnormality is usually said to be anyone that is more than 2 standard deviations away from the mean. And I use the example of schizophrenia, as that's only 1% of the population. They are beyond this kind of standard deviation. The strengths and weaknesses of this, tell you what, I'll use the normal PowerPoint to cover this. So strength is it's quantitative. Yeah, it's objective, it's reliable, it's measurable, and it has lots of practical uses because of that arbitrariness of it. It makes it more scientific. So as I say, it's also arbitrary, which eliminates the bias. Yeah, if we've got, I spelled arbitrary wrong, it's arbitrary, which eliminates bias. Oh crap. It eliminates bias. As you can see, I'm not editing this, I'm just going as quick as I can, so I will be seeing crap occasionally as I do things wrong. So it eliminates bias because we've got one set of rules that we're going from, which is fair and everyone gets treated the same. Problems with this, remember, deviation from the average is not necessarily abnormal. For example, IQ. For example, depression. Depression affects about 40 to 50% of the population at any given time. So it's not statistically infrequent anymore. In fact, it's statistically frequent. Another problem, remember, is that it does not take into account desirability of behavior. So this top point, IQ, if you are above the median line, if you have an IQ of over 100, or indeed over 115 or 130 if we're going for 2 standard deviations, if you've got an IQ of over 130, we don't see you as being abnormal. Even though you're only in the top 2% of the population, we will look at you and see you as being special but not abnormal, which has a certain connotation to that term. Those are the main evaluation points of that. I'll see what else is in the mark scheme. Yeah, so all of that is just what I've already just said. So that is the definitions, or the 2 definitions we've got of abnormality. So remember, we need to be able to describe the DSM, and I'll quickly go through the DSM now. So the DSM, we use the DSM-5 now. We've just changed over, remember. And the DSM is a big book that has all of the symptoms of all the different mental illnesses in it. And we've listed them all down, and what we do is we see how they apply to you. The point of this, remember, was to make classification simpler, to make sure all doctors and all researchers were using the same classification and not their individual criteria and things like that. So it was designed to make things more reliable. It also makes things more valid because we update it every sort of 16, 15 years, something like that, which is why we've got a new one. We take into account all of the relevant research, new findings, and update it. How we update it, though, is often criticised. There's lots of things that are put in through kind of votes. Some people have said that there's not enough evidence for them, and various things. So, for example, when I was talking about temper tantrums earlier on in the video, some people have suggested that having a mental illness that diagnoses 5-year-olds is wrong, and we haven't got really enough evidence for it. So remember, the DSM uses what we call the 5-axis system as well. So there's 5 axes. The first one looks at the principal disorder that you've got. So this is what brings you through the door. You've got the symptoms of schizophrenia and we'll classify you as such, or you've got bipolar disorder or whatever. Axis 2 looks at any kind of personality function or personality disorders which would influence that. So let's say that you have a learning disability, and that you may feel constantly overwhelmed. Yeah, but feeling overwhelmed at that point is not a symptom of kind of being depressed and lacking in your self-confidence and things like that. You'll be overwhelmed because lots of situations will overwhelm you. The third axis we look at is any medical problems. So, for example, we look at biological factors that could influence your mental illness. So, head injury, or the example in here, if you've got asthma. Yeah, if you've got asthma, you might have an asthma attack, and it's very easy to confuse those for panic attacks. Panic attacks are symptoms of mental illness. Asthma attacks aren't. Axis 4 is any psychosocial stresses. So, death of a spouse, divorce, job loss. These are social factors that could either influence you in getting a mental illness, and once they go away, so will your mental illness, or they are things that could be confused for mental illness. So remember, until recently, you could not be diagnosed as depressed if you had suffered recently the death of a spouse, because they would say that we're confusing sadness with actual depression. And finally, axis 5, the level of function. This is where we look at how well you are kind of dealing with and running in society. And we measure it on a scale of 1 to 100. I'll leave that on there for a few seconds. Actually, I don't need to. You can just pause the video if you want to have a look at this properly and make notes. And I will move on again. So we need to talk about the reliability and validity of the DSM. So we start off by talking about, are diagnoses valid? Chances are in the exam we'll use this as an example. You'll come up with somebody, so you've invented Colin, who's got schizophrenia or depression or whatever. You've come up with a guy and give him mental illness. And what you need to be able to do is say about whether we are validly diagnosing this illness or not. And there's the different types, remember. So this top one, validity in diagnosis, means that the symptoms of the patient match those considered to be present for this disorder. This is basically descriptive validity or diagnostic validity, something like that. So this is descriptive validity, which is one of the kind of keywords we talked about with this. A client diagnosed with schizophrenia using the DSM should have at least 2 of the symptoms continuously, or at least for 2 months, or diagnosis does not fit the necessary criteria, so lacks validity. That's again part of that descriptive validity. You have to meet the criteria. Diagnosis is valid if it predicts the course of the illness accurately. So, if diagnosed as schizophrenic, periods of mania should not occur. Yeah. So your symptoms should follow those of schizophrenia, not something else. And we should be able to predict how they're going to affect you over time. That's predictive validity. The same for the next one. The treatment or therapy that we put in place. So if we give you medication, that should make you better. Again, what you can say is you get a mark for using an example or expanding it. Yeah, remember, you don't need to always give 6 points in evaluation things. You get marks for expanding and explaining. The diagnosis is valid if people who share the same symptoms are given the same diagnosis. So again, this uses kind of descriptive validity. Remember, a problem with schizophrenia is one patient could have symptoms A, B, C, and another patient could have symptoms D, E, F. So 2 different patients have 2 different symptoms, or 2 different sets of symptoms. We can talk about concurrent validity. 2 tests of the illness should have the same result. So the DSM and the ICD, or DSM and a blood test. Finally, we've got Rosenhan. Remember, you know what Rosenhan shows. I won't go into it in detail, but we can show that patients can lie about their symptoms, so that makes it not valid. But also, the doctors were unable to say whether these patients truly had a mental illness or not. Reliability, we've also got inter-rater reliability, where 2 different doctors should be able to diagnose you with the same thing. Or we've also got test-retest reliability. If I test you for mental illness now, and you say you've got schizophrenia, you should also have the same diagnosis in 2 or 3 months' time. It shouldn't change. Right, I'll get started on the next video now. Thanks.